Before we start this episode, I wanted to tell you that if you're looking for free dog training courses, you can take the Victoria Stilwell Academy's most popular free course, Building Your Dog's Confidence, right now by going to vsdogtrainingacademy.com. That's vsdogtrainingacademy.com. Okay, now on with the podcast. I know the best people. And I know you know that because you listen to this podcast a lot. But I really do have the best people, working for me, and also I know the best people in the animal world. And one of them happens to be an amazing vet called Dr. Belyeu, and he is with Peachtree Hills Animal Hospital. And he has very kindly agreed to come on this podcast to talk about medical stuff. As a dog trainer and behavior expert, you know that I cannot really talk about medical stuff at all. And we rely so much on our veterinarians, not just for medical, but also when things appear to go wrong with behavior. They're our first port of call whenever there is any kind of behavior issue. And it should always be your first port of call, the veterinarian. And if you happen to have a great vet, like Dr. Belyeu, then you're lucky. But if you don't, well, then stick around and listen to this podcast because I'm going to ask loads of questions. First of all, welcome to the podcast.
Thank you. Thank you for having me. I'm excited.
I'm so glad you're here. And before we begin, can you tell us a little bit about yourself?
Yeah. I am Mark Belyeu. I'm a veterinarian in Atlanta, Georgia. I grew up in Florida, actually, but moved here many years ago and have been practicing in Atlanta for 9 years, but been a veterinarian for 10. I love my day-to-day job, meeting people, meeting pets, keeping them healthy, keeping them happy. I have a dog myself. He's sitting right here. So I am a fellow pet owner as well. And I'm just happy to be here and give some knowledge and just kind of chat.
Now, you're always because of course I take my dogs to Peachtree Hills, and whenever I go there, you're always so kind and so upbeat. But I would ask, a job of a veterinarian, that's the training is vast, years and years and years and years.
Yeah. And
the job itself is really hard and must be quite emotionally draining. Yeah. How do you keep going in a job like this?
It is hard. You do have to take a step back and remove yourself from certain situations and say, I obviously have really strong feelings about this, but for me to provide the care to the next patient, you clock it, you say, I really do empathize with this moment. And I want to give myself the most that I can to the next patient also. So you learn to kind of adapt to the moments and just accept that it's really, really crummy certain times. Other times it's really awesome and you're just like excited to be part of that process. But you want to make sure you give your attention and your empathy and everything that you can to the next patient also. So it's a learned skill. I think as you get more years behind you, you just kind of understand that you have to be there in those moments for those people, just kind of how they need you,
When there is a lot of burnout, it seems, with veterinarians.
Yeah.
How do you avoid that?
We have done a lot in the last few years with our profession of focusing on work-life balance. So I think in the past we were more accessible to the generic public for text messages and emails, and even people showing up at your front door, where I think now with the profession, there's a bit more ability to get access to care, so with telemedicine, with urgent care hospitals and ERs, those are more prevalent and popped up more. So we can take the time when we're not on the floor and in the office to actually just, recuperate. So I think the work-life balance aspect has really shifted even in the last 10 years since I've been in it. So
that has just been, there's been more of a focus on veterinarians' mental health.
Yeah, for sure. And I'm sure the statistics that veterinarians are 2 to 3 times more likely to have mental health issues, suicide tendencies than the general public. So it does take a toll. But we at Peachtree Hills and in the profession are really trying to make sure that we're taking care of everybody,
And we're talking about everybody. We're talking about vet techs as well.
Yep.
Everybody from your front of house staff to your vet techs to your veterinarians. And I think that's so important. And do you know what? As somebody who brings our dog to the vet, not only is the dog worried, of course,
Yeah.
and you guys do what you can to make our dogs and our cats and our pets as comfortable as possible, but they can still get worried. Like we get worried when we go to the doctor. I have a great doctor, but I still don't really like going.
Yeah.
And it's also important, though, that everybody is friendly and nice, because we're also, when we take our dogs to the vet, especially if there's something wrong,
Yeah.
we're also a little bit stressed out.
Yeah. I agree. And we have ways that we've worked through how to approach patients, how to approach clients that are empathetic and fear-free driven, so that's a big tendency that has shifted in our profession also. I'm fear-free certified. We really try to make sure that the visit can only be better than the last one so that we can get really good care. And like you mentioned earlier, if there's a behavior issue, we want to really get a good exam in and make sure there's no pain. We want to make sure that there's the ability to get blood work. So if there is a systemic abnormality, we can hopefully, curtail it and maybe fix the behavior problem or help with it, So being a calm approach really does help us do a better job, and then actually does help with the family making behavior decisions or just overall decisions for their pet.
Well, that was my next question. If somebody brings a pet in, and let's just focus on dogs, because if somebody brings a dog in and you see some kind of aggressive response at or they're concerned about some kind of behavior, maybe the dog is exhibiting more separation issues, maybe the dog is growling a bit. What is your next step as a vet? How would you look at that?
First, we just always want to be safe. We want myself to be safe, my techs, my front staff. We want the pet owner to be safe too. A lot of times if there is a fear response, they're going to maybe be a little protective of their owner. Our rooms are, they're not the biggest rooms in the world at our clinic, and I'm probably sure at most across the country and the world. So it could feel like a very enclosed space. So I try to minimize my impact in the room, get low, not make eye contact with the pet. If they're growling, I'm not going to sit and stare directly at the owner and the pet. I'm going to look to a different distance in the room. Maybe have we have treats in the room, throw them on the ground, see if they approach the treats, but not try to extend a hand. Sometimes I'll say, hey, mom, dad, can I grab the pup and take a little walk around the clinic? So they pass the leash off and we just do a little walk around so that they can get a little bit used to me, maybe a little different scenario. I mean, who knows? Hopefully we didn't have a bad interaction the time before, but who knows what their interactions have been at the vet before. So just trying to understand, it's a scary place. It has a lot of smells. You have other dogs barking and cats meowing, and it's a lot. So we just want to go slow and just make sure everyone's safe in the big scheme of things too.
How much have you seen that pain exacerbates a behavior issue?
All the time. Yeah. So, the hip pain and the back pain, when you're even just doing your exam, you have the sweetest, loveliest dog in the world, and they kind of turn and they're like, hey, that was a little bit more than I expected. So even in those moments, you're like, okay, yeah, I know this is the sweetest dog. But if I just kind of push the wrong little area, they can just react. And it's not like they're being mean. It's just them reacting and protecting themselves.
When you do have a pain issue, so let's say my Chihuahua, Jasmine, and she's 14 years old now and definitely has some arthritis, especially in her wrists, and now has developed this back issue. Mm-hmm. And so she's an old girl, and we noticed that she was doing a lot of licking. She was certainly doing a lot of licking on her wrists, so we brought her in. And licking can be a sign of allergies, but it also can be a sign of pain. Do you see that a lot in dogs?
Yeah, we really do. Those subtle things that we don't always think about as pet owners are signs that they're showing us. Even just the simple, they used to love going on their walks and they're like, I just would rather stay in the house. Or the jumping in the car, like, the golden retriever who just loves running to the beach or, the park. And then they're like, I could stay home actually and be okay. Yeah, those subtle signs are what we're trying to pick up, and that's with our questioning, that's with our exam, and just trying to have owners kind of think about, yeah, it's not just the vet pushing on the knee or the wrist and saying, yeah, hey, yeah, it's swollen or painful here. It's looking at the whole picture.
And so medication
Hmm.
has definitely helps, obviously, with pain and arthritic pain.
Yeah.
I have to say there has been, and I don't really like to say names on this podcast.
Hmm.
This isn't a commercial for Librela, but I have to say that has completely changed my dog's life when it comes to arthritic pain. Can you?
Yeah.
This miracle drug.
Yeah.
And I was a bit, skeptical. Really,
Hmm.
does a monthly injection, is that really going to help my arthritic old dog?
Right.
But oh my goodness, within, and apparently you have, well, I was told this, after maybe the first injection, you don't see really that much change until the second one. But boy, did I see change within like the first few days of the
Right.
first one.
Which is amazing. I mean,
It is amazing. Can
so
you
cool.
talk to me about this drug?
Yeah, I mean, that specific one, Librela, it's the only one in its class on the market that it's an injectable monoclonal antibody, meaning it is a protein that basically binds. So it binds excess nerve growth factor, which has been shown to just be a really inflammatory agent within the joint. So as long as it is in reduced quantities because of the injection, it doesn't have the ability to kind of send that pain signal up to the brain, which then also reduces inflammation secondarily. So it kind of has like a double whammy. And it's just really the great thing about the medication is we have consistency of knowing like that pup got that injection and we know that they're going to have it for 30 days and we can do it again in 30 days. We should, but a lot of times, and compliance not is a bad word, but sometimes medications don't get given to the pet or the pet spits it out when we're not looking. So we don't know that every day that the arthritis injection or the arthritis medication specifically is getting to the pet and hopefully helping, so at least I know as a vet, like, hey, I've done my job for that pet's pain for 30 days,
The when the difference with Jasmine when you after she had it was like night and day. I have to, as her caregiver, bring her in every month to have her injection.
Yeah.
And it is quick and it is easy. And actually, I have to say it's really good value for money because if you can, it's really not expensive. And if you can help manage your pet's pain and give them comfort, then it is so worth it. So I've definitely seen a change in her. But, she's getting older and we wish that our pets lived longer. But okay, so I just want to focus on Jasmine and pivot a little bit to talk about teeth.
Yeah. Yeah.
Ever since Jasmine came to me at 6 months, she's had a problem with her teeth. She had, when she came to us, well, first of all, we went to a rescue shelter to get her. We didn't know what dog we were going to get, but we found this little Chihuahua that didn't want to interact with anybody. And her canines were sticking straight forward.
Yeah.
Like that. And the vet at the time thought that was because she might have been chewing on the bars of a crate.
Gotcha.
Which sounds like it happened because the people who brought her in apparently brought her in a box and said, we don't want her anymore. She's pooping everywhere.
Gotcha. Yeah.
And shoved her over the counter and walked out. So was she kept confined? I think she might have kept confined as well because she also ate her poop. She didn't just eat it, she played with it, then she ate it. And so then I got all these signals that potentially, well, maybe she actually didn't have any toys. She didn't have anything to kind of play with. She didn't have much interaction. And I don't know. Anyway, so we kept those in her mouth for a while, but then they eventually had to be removed. Keeping a Chihuahua's teeth clean has been the nightmare of my life.
Yeah. Teeth and pets are so hard. We brush our teeth twice a day. We floss. We go to the dentist twice a year. we still have tartar and plaque, and they use the curettes and they scale and, do the same things and put the fluoride treatments on. I would love if every one of my clients would brush their pets' teeth twice a day. I can pretty much guarantee it's not going to happen. A handful will do it. What else can we do? And the Chihuahuas or the small dogs or any pup who's like, please, I don't want toothpaste and toothbrushes in my mouth. Like, it's not going to happen. And we're also not going to get in between each little crevice and things. My goal is just to make sure, I kind of always say this in the room, I want a pet to have a pain-free mouth, an infection-free and pain-free mouth. So that just means if there's a mobile tooth that could be causing discomfort, let's get it out. If there's a fractured tooth, they don't need them. I've personally owned a dog that had 0 teeth. When we were growing up, a little Yorkie, bad dental disease. We ended up having to have all her teeth extracted by the time she was 9. Then I got into the profession and really realized how much that really meant. And she was a happier dog. She had no teeth and she gummed her hard kibble and she loved it. And she was just, it was really important for me to see that too. And I'll tell you so many times I'll take out a tooth and weeks and months later, they're like, I didn't realize how much it was affecting them,
Yeah.
So anything we can do, whether it's brushing, I give my dog a dental chew every night. I do dentals on him frequently, every couple, year or two. He's a 45-pound pup, so he's not as small. And I just keep an eye on his teeth too. That's the big one. If I start to see tartar and gingivitis, I'm gonna step in and do a dental cleaning. And that's not to say anesthesia is not scary, and that's a conversation that every vet and pet owner needs to have. But it's a reasonably safe option to make sure we're taking care of their mouth so that they are pain-free and infection-free.
I would say one of the highlights of my career was to go on. Anderson Cooper had a show during the day, and he had a talk show. It was a number of years ago now, but I don't know whether you ever saw it. I'm a huge Anderson fan. Anyway, and I went on his show twice, and he is the loveliest person. He had his dog. He had an old dog, and
Spaniel, I think.
Yeah,
I think.
Well,
I remember
it was a spaniel.
I think so.
Yes, I think so.
Yeah.
And I went on the show. It was the first show that they done. It was like the start of this whole talk show thing that I think went on for a couple of years. So I went on the show and we were talking about teeth cleaning. Mm-hmm. And I remember he did this thing where he tasted the dog toothpaste and everybody in the audience was like, and Susie Essman was there and we were all laughing about yada. And I said, you've got to brush your dog's teeth every day. Why they got me in to do it. But we were talking about other behavior stuff. It wasn't just teeth. But I said, check with your vet, but you need to brush your dog's teeth every day. Did I brush my dog's teeth every day? No, I didn't. Right. I gave her dental chews. I tried the stuff in the water. And so, but with small dogs, it's a real battle. And then I was like, I have to really practice what I preach. So I started brushing your teeth. Now, I've used every single little trick under the sun. Now I brush, and I only brush once a day. I don't brush 2. So maybe now I should brush 2. No, but I have to use a cotton bud.
Okay.
So I put this stuff on the cotton bud, and she doesn't have very many teeth left.
Right.
And then I do that. But I seem to be fighting a losing battle I always have with blimming teeth. But it is so important, isn't it?
Well, yeah, it extends quantity and quality of life.
Because if you have a bad mouth, doesn't that affect your organs?
I mean, you can have, every time we chew, they chew, bacteria gets shed into the bloodstream. So that bacteria is just going to go throughout the whole body. I've had cases where liver values have been increased on blood work pre-anesthetic. Do a dental recheck, and those liver values are normal. I mean, I assume it was the dental because we took away the problem and the liver value improved. So, I don't have perfect evidence to say that was the case, but it seems pretty in line with me. But it's not gonna hurt to make sure that we just take that off the table, get rid of the pain and the infection, and they're just going to be happier in the long run for that.
Yeah. Okay. After the break, I want to talk to you about hot weather because I have this thing, Mark, that just drives me crazy.
Right.
Stay tuned, and I will be back after this message. Are you a dog trainer looking to take your knowledge and skills to the highest level? Or maybe you're a dog guardian interested in figuring out whether your love of dogs can translate into more of a career than a hobby. Or are you already working in the pet industry but recognize that you need to fill some gaps when it comes to how to manage dog behavior so that you can better serve your existing clients? No matter where you are on your journey, the Victoria Stilwell Academy has courses that can help you get to where you want to go. From our free Building Your Dog's Confidence starter course to the powerful Fundamentals of Dog Training and Behavior course, all the way up to our flagship Professional Dog Trainer course, we have options for every skill level and budget. All you have to do is be passionate about giving dogs the best lives possible. All of our courses are available online anywhere around the world 24/7. No gimmicky sales tactics where you need to act within a certain window to enroll. My amazing team at the Victoria Stilwell Academy understands that we need to be ready to serve you whenever the time is right for you to make the jump. Whether that means dipping your toes into our free courses or realizing your fullest professional dog training dream by enrolling in the dog trainer course. So, join the thousands of dog geeks like you that are a part of our amazing and supportive VSA family today. We have Academy specialists available to talk with you and figure out how we can help you reach your dog training goals, or you can enroll in a starter course for free right now. The Victoria Stilwell Academy. It's the future of dog training. All right, I'm here with Dr. Belyeu. We're talking a lot about all things medical, which is great. And yes, so I have this thing where it is 95 degrees here in Atlanta. It is hot and humid and horrible. So why are people still not just walking their dogs in the middle of the day or the hottest part of the day, 3 or 4 o'clock, but running with their dogs? And first of all, I don't want to be judgy. I don't want to be nasty, because at least they're getting their dog out.
Right.
And they're spending time with their dog, and that is commendable.
Yeah.
But how can we tell people that these dogs are panting? They look like they're really going through something traumatic.
It's hard. I struggle with the same thing I have an active young middle-aged dog who needs his exercise, and if he doesn't get it, he's a lot in the house. We throw the toy a lot. I urge just to do parts of the day where we know that they're just not going to be struggling. And we have to take each breed and each pet into account, dogs specifically, the brachycephalics, the Frenchies and the bulldogs and the pugs, they're going to struggle more. So understanding that there's extra tissue up here, their tracheas are a bit narrowed, their nostrils are a bit narrowed. They're going to have a harder time dissipating that heat from the panting. They can get swollen back here. I've seen heat stroke patients, and it's not pretty. It's really scary. I've seen one pass that I can think of off the top of my head. It can be really scary. So I don't think it's worth the risk of the middle of the day runs and everything. I think it's better, say, the early mornings before the sun comes up, or as the sun's coming up, and the evenings when it's going down, or at dusk. And then checking the pavement, making sure that if your hand or your foot is on the pavement and it's hot, we've all been at the pool and the patio where we're running from the pool to the chair, because it's the same concept. If it's too hot for your feet and your palm, it's going to be too hot for their feet too. And then we have to have them go through pain if they have their little pads, ulcerated, and bandage them. And it's sad, but it could be really scary, and it can lead to, we were talking about organs. It could lead to organ damage if we get into the severe signs of heat stroke.
What are the signs of heat stroke? And if you think that your dog, obviously, as I'd say, take them to the vet, but what can you do? So what are the signs, and what can you do?
Panting is the first sign that they're dissipating their heat, because they don't sweat like we do yet, a little bit on the pads, but they're just excessively panting. We have a word called tachypnea, just an excessive amount of panting that they just cannot catch their breath. They look headed towards disoriented. That's kind of like spacey look, like I don't know what's happening. Best things are get them in a cool environment, and not like a tub with ice. It's mostly just get them into an air-conditioned home. We'll get them in the car so that we can head towards the vet. You can mist some room temperature water on them. you want air flowing across them, you can put the fan on. Again, we don't want it super cold because we don't want to vasoconstrict all those vessels if we make it too cold. You just want enough kind of like air to help with that evaporation technique. But yeah, get them to the hospital so we can get them on some IV fluids and do some cooling. If they're
What
really
about
severe, yeah.
what about the gums? How can you tell that if your dog is getting overheated by looking at their mouths?
They can become pretty red, like that capillary just becomes really bright. Blue capillaries, if you see kind of that bluish purplish hint, that's less oxygen getting to the tissue. But if it's really red and injected, that would be a bigger sign of that.
And what did you say? So you don't put ice on because that does what?
It'll constrict the vessels, and we want the vessels towards the periphery to be open so it dissipates heat. So you don't want to put anything like super cold on.
That's
Want, like,
really
room
important.
temperature.
Because that's what you would think. Oh my gosh, this animal's overheating. Let's just pack it with ice.
No, yep, just good airflow, misting temperature water, even just like room temperature. I know there's an old adage of like putting alcohol, like rubbing alcohol on the pads. Not necessary. Just stick with the water and the air and the flow and get them in a cool environment or headed towards the vet.
Okay. Now, and I'm reading because I have a lot of people asking questions. Okay. So vaccinations.
Yeah.
I'm, of course, a big supporter of vaccinating your dog, especially when your dog is a puppy. And here there are certain rules here in the United States where we have to get our dogs rabies every year or every 3 years, depending on what kind of shot you get.
Yeah.
But talk about vaccinations for people who are getting a puppy.
Mm-hmm.
What should they be looking at? And then we'll also, after that, discuss about when can I take my puppy out to do all that important socialization before 12 to 16 weeks, but yet I can't because my pup's not vaccinated.
Right. Most, there's groups of veterinarians who have come together to say like, they've said this is a really good protocol for puppies and kittens to do a vaccine series. And most vets have adopted that as their standard protocol. So the reasons we kind of do so many in the beginning is we're just hoping that the mother's immunity was passed, through the colostrum and through their nursing, and hopefully the mother had good antibodies that she was passing along as well. So if it was from a breeder, we would suspect that there's going to be antibodies passed. If it's a rescue pup, maybe not. We're not sure. So at around 8 weeks, the pup's immunity is going to start declining. The antibody is going to start declining. And then we're hoping that with our vaccines, we're going to be able to kind of entice their immune system to create antibodies to those vaccines. So we don't know exactly when that perfect window is. So for the series where we do so many of the distemper and the parvo, we're just really kind of hoping that pup reacts to that vaccine to create the antibodies so it doesn't get parvo or distemper. And then, like you said, at the 16 weeks is kind of when we're calling the puppies fully vaccinated. That's usually when they get their rabies vaccine. And then there's some lifestyle ones, like influenza. There's 2 strains of that. There's a vaccine for if a pup is going to be really social, if they're going to go to dog parks and daycares and things, would be a good idea. Bordetella, the kennel cough vaccine, is pretty standard at this point. We kind of almost consider it a core. Bordetella or boarders and groomers are going to usually recommend and require those. And then even leptospirosis, one of the vaccines that wasn't as core in the past, but we're seeing even in Atlanta here. It used to not be such a big problem, but it's kind of moved from the Northeast down and across the country. It's really important to kind of discuss with your vet if your pup is out there and walking in wooded areas or even just out in the environment, leptospirosis vaccine might be a good one for them.
So we always were told that we'd get the leptospirosis because I had a Labrador and we were always up in the North Georgia mountains, and she loves to go in the creeks and the rivers and swim, and so we got her leptospirosis. But you're saying that it's not just even from water sources. No,
I mean, I'll be honest with you. We're in the city, and I've had a patient come up positive, and they just live in the city, and it could be a pretty terrible disease if they are exposed to it. Can hurt their liver and their kidneys. It can be zoonotic, so humans can get leptospirosis. So we just don't want to have that potential risk, and it's shed through the urine. So they usually say water sources because as an animal, like a wild animal urinates, it could end up with like a rainstorm. It'll end up in that puddle, and your pup will step in that puddle and lick their paw or lick the puddle. So yeah, I urge most of my clients, if we have a pup who is going to have not just live in the high rise, like let's really consider it, you know?
I knew somebody who had leptospirosis, and it
Oh,
was
really?
very, very serious disease
Yeah.
and impact them for the rest of their life. So
Yeah.
yeah, it's if your vet says that there's lepto, that you probably should get it. It tends to be, though, quite a harsh vaccination, isn't it? Or that's its reputation. I don't know whether it's different now.
We rarely have vaccine reactions. We have them, and they range from some hives and some swelling and like facial swelling to, the more severe cases or the vomiting and diarrhea. A handful, again, I can't think of many off the top of my head, have had the big reactions, anaphylactic, where we've given steroids and epinephrine and things, but we give hundreds of vaccines at our clinic every day, and we rarely have reactions, and leptos included in a lot of those vaccines.
Right. So for people, though, who have puppies, the old, I guess, back in the day, and maybe still now,
Yeah.
veterinarians will say you can't take your puppy out until they've had their full round of vaccinations. Well, then, of course, we know that the primary socialization window is from about 3 weeks to 12 weeks.
Right.
You can extend that a bit to 16 weeks, but that is your primary socialization window. If you cannot take your puppy out and expose them at that time to other dogs and environments and situations, well, it's going to be much harder to socialize them. But how do we make sure that they're not going to pick up any diseases? What is your advice?
I say let's be cautious. We say we lived in an apartment complex with hundreds of dogs that live there. I'm going to avoid that park where all the dogs are going to go do their business. If I have a 10-week-old puppy and my best friend lives down the street and they have a year-old dog that's really great with puppies and it's fully vaccinated and it's going to do really great socializing with that pup, I think I'm gonna say, hey, you know what? There's a very small risk that my friend's 1-year-old dog is going to carry something. I think it's going to be a good socialization. So ultimately, if you have people and pets in your life that you can trust that are well vaccinated and are healthy at the time, the risks, obviously, you can't fully mitigate any risk, but I think it's going to be really minimal. I'm just going to avoid the pet stores, where people are walking around. I'm going to avoid the dog parks, like the communal ones, but even just like the ones where you have to pay to get in. So there's always risk. There are some classes, and you would probably know more about the specific ones around towns that are meant for puppies of the same age, so they're all in their same vaccine series too. So those are good options.
Yeah, the puppy parties that happen that in a very sort of a well-sanitized environment that every care is taken so the pups can socialize and be safe as well. And then, sometimes I always say with puppy parties, just be careful, because with puppies, it doesn't mean to say because they're puppies that they are all the same.
Right.
So I see sometimes that people bring their very shy puppy into a puppy party and puppy play, and they're like, go and have fun, my son. And then it's just not fun at all.
They're just like overwhelmed or
Yeah. So just because your dog is a puppy and there's a puppy party in your area, make sure, first of all, that they have really great hygiene practices, but also that your puppy is comfortable when it goes there. And if it's always running back to you and hiding behind the chair or doesn't want to be there, then maybe you can do some of that one-on-one play, like you were saying, where you can just gradually introduce it to a dog that is gentle and more, and that's so much better. Okay. I do want to talk about medication for behavior.
Yeah.
Here's the thing. From our point of view, a trainer's point of view, it's really important to, if we have a behavior case, that we don't go above our pay grade. So, for example, if I've got something that I feel has some kind of medical component to it, and I need somebody to address the medical and the behavioral, I will first of all go to my vet, and then I will go to a vet behaviorist. And so the team, including myself, will work on the situation. But the vet is always my first port of call with anything, really. Before I take on a case, it's always I want this dog to get a clean bill of health as much as they can before I start working with it. If I've done a lot of training, or even before that, if I don't think the dog is able to learn, or is too stressed out, or is too anxious,
Right.
then it might be time for some kind of pharmacological support.
Yeah.
Now, a lot of people are like, I don't want to drug my dog. Is this going to change my dog's personality? But I would say keep an open mind, talk to your vet, talk to a vet behaviorist if you can. But what do you say on this subject?
There's not, as you are aware, and I'm sure a lot of people are, there's not a lot of veterinary behaviorists in the country. So I think there's maybe 50 or so, give or take. We're lucky to have one in the Atlanta area. We get training in vet school. We get training in all aspects. So we get dental health and, everything under the sun. So we have behavior training. We have experience with seeing patients and how my medication prescription has helped that specific patient. But I won't say I'm the area expert on behavior. So it's a really good thing to have that initial kind of conversation like you're saying. And let's say I want to try to figure out whether I'm dealing with a situational anxiety or a generalized anxiety. So if we have a pet who has situational anxiety, so I'll use my dog, he has thunderstorm anxiety. I'm sure I could behaviorally train him to not hate thunderstorms. I could buy a CD and I can do sounds of thunder and I can go slowly and do it. But at some point, I may not be able to kind of break that barrier with him for him to be okay with thunderstorms. So I use medications during those times to make sure that he just doesn't have a terrible day when that thunderstorm rolls through, and it's safe and effective, and it doesn't change his personality, and he's not dependent on it. The generalized anxieties are a little harder, so they probably just have this underlying fear, and then they're just not going to learn. They don't have the capacity at that moment because they're just in fight or flight. So if I can just dampen that fight or flight, reduce that cortisol, get that epinephrine just a little under control, they might be like, oh, I'm able to listen. I can actually learn that command or understand that I don't have to be so anxious with whatever, situation it is. And then even some supplements are beneficial. There's companies that have made some, and there's even some diets, more on the cat side, but there's some diets that have been created that have a little bit of a calming effect too.
Now, okay, let's say I have an elderly dog.
Yeah.
And senior dogs, we know, can maybe because it's pain, maybe because it's some kind of cognitive decline.
Yeah.
Maybe they can start exhibiting, or sometimes they start exhibiting behaviors that you've never seen throughout the dog's life, and now all of a sudden you're seeing them. Yeah. Can medication help in those situations? Let's say if a dog is becoming quite anxious and they're restless at night, you're seeing a generalized anxiety.
Mm-hmm. Yeah. So the generic doggy dementia, canine cognitive dysfunction, we see it quite often. I think there's even reports 70% of pups are going to experience this as they get into their senior years. There are supplements that can help that are going to have antioxidants and omega fatty acids that help with brain, certain diets as well. But yeah, there is a place for anti-anxiety medications. There are some certain classes that we lean on more than some of the other classes of those anti-anxiety meds. And I've prescribed them, and I've had both accounts where the owners are saying, it was great, it was perfect, thank God we did it. And the others were like, we didn't see a whole lot. I'm glad we tried it, but it was worth giving that a shot. Or I've changed from a different type of anti-anxiety medication to another one and had better success. So sometimes it's that trial and error and giving the pup the freedom to kind of have the time to show us what they're going to show us when they switch over to that new protocol.
In my own experience, when we lost our Bella, who you knew, my Shih Tzu Bella, Jasmine, who's really never been an only dog, she came in when I had my lab, and then between Sadie dying and then us getting Bella, it wasn't that long.
Yeah.
So being an only dog, I mean, she really I saw a definite behavior change in her, in the
Yeah.
fact that she was just more anxious. She
Right.
was pining. She was just more sensitive to sounds. And I think that could have been the pain as well, that she was just general arthritis. But I saw such a change in her behaviorally.
Right.
And I knew at that point, after a month, that things weren't getting better.
Right.
And so that's why I came, and we now have Jasmine on just some daily medication that has truly made a marked difference.
Yeah.
So now it's been a good 6 months since Bella has passed, and Jasmine's we've kind of got her back to her baseline, where she's happy, she's able to enjoy things again. I really do believe she was grieving, even if you can't call it grief. She was missing her. There was something.
There's a change.
It changed. Can you wean them off? Can you, like, what is your advice for that?
Yeah. I mean, every vet's gonna have a protocol that they've experienced that's worked. But yes, you can. And if we start weaning, we don't want to just cold turkey stop an anti-anxiety medication. So say you're doing it once a day, maybe you do a half dose, again, talk to your vet, but like maybe go half for a while and then go another half or every other day for a while. And then see if we just have a return to that abnormal behavior and the lack of confidence. These medications aren't scary. They're beneficial for helping just get, like, SSRIs, get serotonin up in the system, I wouldn't be against keeping them on it for forever if we've had a great run of it really showing improvement. But if we want to try, we absolutely can.
Yeah. So we're in that process of now beginning to think we're going to start cutting back.
Yeah.
Because she is back to normal, and whatever Chihuahua can ever be normal. But but she is, and I think she's now existing and accepted that she's the only dog there. But I did buy her Arthur. So Arthur was a dog I went to New York City, and I was really grieving my mom. It was a year since my mom had passed away. And I said, there's two things that I'm going to do to mark my mom's passing. First of all, I'm going to go to St. Patrick's Cathedral. I'm not very religious, but I find the cathedral very calming when I'm in the city. And so I went there and lit a candle for my mom. My second stop that I knew that I was going to do was to go to FAO Schwartz to buy myself a soft toy so that I could cuddle this little soft toy. So I bought Arthur. Arthur's a beagle puppy. And so that, just for me. But then I thought, well, you know what? Maybe Jasmine could benefit from Arthur.
Yeah.
So maybe Jasmine needs that soft toy as well. Well, I laid Arthur, who's about Jasmine's size, in Jasmine's bed, and that was it. Arthur is now Jasmine's. And she gains comfort from that dog. And when she goes into her bed, she lays her head on this dog. Arthur is there.
Yeah. That's so cool.
Isn't it cool?
Yeah. That's so sweet too. That she was kind of missing something, and you were able to kind of find that really just gave her that comfort.
Yeah. You know what? It takes a village, Mark, and I am so glad that there are veterinarians out there like you that really understand the behavioral side, that you are fear-free certified. And of course, Marty Becker is a great friend of us and a great friend of Positively's, and we support fear-free. And we're really happy that you are fear-free certified too. I think it's important. For those people who don't know what fear-free is, can you tell them?
It's, Dr. Marty Becker created it. And it's a systematic way of thinking about approaching a pet when they come to the hospital or just in general, making sure that we can reduce the signs of FAS, fear, anxiety, and stress. And there's techniques, there's medications that you can employ, there's trainings. I've learned things that I didn't know about in vet school, like, for instance, cat scratching. I've learned that behavior a little bit more in-depthly because of the courses. So it was a really interesting, great way to think about how to approach a patient. One of the things that I really took away from it was needs versus wants. So what I mean by that is I really want to get a really perfect exam on every patient. Do I need to look in that pup's ears if he's not tolerating it and has no signs of ear infection? Probably not. I don't need to stress him to the point where I'm going to have a really bad reaction to him, me. And so I'm not going to get a good remainder of an exam, so do I need the blood work? I don't absolutely need it, but I want it, so trying to decide what those tolerance levels are with each pet is kind of the goal.
I love it. It's almost like obviously fear-free certified. You can become fear-free certified as a vet, as a vet tech, but also as a trainer. It's also, it's exactly the same with us trainers. We might have like this perfect thing of what we're going to do and what we're going to achieve during a group class or during a private session, but you might not get there. And you know what? You pick what you can without stressing the dog out. And if that's all you can do, that's all you can do.
Exactly. Yep. I always go into the room like needs versus wants,
Yeah, of course. Dr. Belyeu, thank you so much for joining this podcast. We're going to have you back on. I would love to have you back on because every 6 months there's going to be more questions that I want to ask. And you've been very generous with your time because I know you're super, super, super busy. So thank you so, so much for joining us on this podcast.
Appreciate it.
All right, guys, thanks for listening. And I truly have the best people on here. And we cannot thank the veterinarian profession enough for doing so much for our dogs, especially for Peachtree Hills Animal Hospital, for doing so much for the dogs where I live and also for my babies too in all of their life stages. All right, well, hope you had fun listening to this podcast and I will see you all again soon. Take care.
Thanks for tuning in to Victoria Stilwell's Positively podcast. For Victoria's online dog training courses, more information, and helpful dog training tips, visit Victoria's official website at positively.com. Get connected on Facebook, Instagram, and other social media as Victoria Stilwell, and follow her on Twitter at Victoria S. Learn to become a professional dog trainer with the Victoria Stilwell Academy at vsdogtrainingacademy.com. And be sure to tune in next time as Victoria helps you and your dog live your best life together, positively.